Broadcasting from Salisbury University campus, this is WSDL Ocean City, NPR News Talk 90.7, putting Delmarva first. Stay tuned for Delmarva Today with your host, Don Rush.
The coronavirus pandemic has hit the nation hard, but for the undocumented population, it can be doubly so. Welcome to Delmarva Today. This is Don Rush. In Delaware, the number of coronavirus cases and deaths have been rising steadily, but for the undocumented, it presents special problems in seeking relief during this time of economic crisis. On the phone with us is Erika Gutierrez. She is a community advocate with a number of groups in the state, and welcome to the program.
Thank you so much. Thank you for having me. I appreciate you taking the time to dedicate a segment for our community. We need to use our voices at this moment. This pandemic is devastating our communities, and it's important for us to use our voice. Thanks for having me.
So, what has been the community's response to this virus, just in terms of whether or not they're concerned about whether they're going to contract it or not? What's the sense in the community, first of all?
Well, the community is confused. The community has been provided with little information about, since the beginning, it was provided with little information about the pandemic and all the different precautions that needed to be taken. Good efforts have been taken, but our community seems to be left on the side. And it's something that worries me, worries everybody, because our communities are suffering. There is one undocumented person for every 10 residents in Delaware. Our community is about 10% of the population in Delaware. And there are many families that are unsafe, that work and live in unsafe conditions because there are inequalities that prevent them from having access to healthcare and also to use any resources to support their families if they cannot work or if they get sick. So if they are forced to go to work because they have to provide for the families, and in some of the places that they work, for example, in the factories, chicken factories in Sussex, it is like an endless road of COVID. Like people get sick constantly because the measures that need to be taken are not being taken right now. Everybody needs to get tested because nobody knows who has it, and people keep getting sick. And if people don't get tested, those factories need to close so they can function again. But as things are now, the community is pretty scared because undocumented people don't qualify for, even though most of the undocumented people pay taxes, don't have access to any relief. And there are some good efforts from one of our mayors, Matt Mayor from El Paso County. He designated $500,000 to help with the relief of families that don't qualify for federal efforts. He also has been providing information in Spanish, and everything that a new regulation comes in, he does a video in Spanish for the community to be educated because, every person from any other country that speaks a different language gets sick. And guess what? If we don't take care of informing them, obviously everybody gets sick. We all get sick. So that is like a big deal. Information is a must, and we need to work together with the governor. He's doing is taking hard steps. We acknowledge that, and we want to have a conversation with him so the south of the state can finally have the relief that they need, overseeing those factories, testing everybody, and making sure that the working conditions are safe for the people to come back to work. That is one of the most important things.
Let me ask you this. Erika, let me ask you this. Because it strikes me that a lot of the jobs that, particularly in the undocumented immigrant population has, tends to be service jobs that require face-to-face interaction. And those seem to be the jobs that are probably being hit the most, whether it's restaurants or what have you.
Mm-hmm. Yes, that's right. I had a conversation 2 days ago with a couple of the women. They are mothers, and they actually sustain their families that work in those chicken factories. And they said, Erika, it's impossible for us to not being close to each other. We cannot keep any safe distance because that's the way that the factory is able to produce what is needed. And there is no way that we can be in distance. And we don't know who has it. There is no testing. We don't know where we can go. We don't know if we are allowed. So I explained them, but the information out there is not enough. And we need to address those owners of those factories to get everybody tested. We have testing in the state, and we have to use them because even though like many of the rich people that live downstate, they don't care about the poor community. They don't like the poor community, especially immigrants. Well, it's up to them because they're going to end up getting sick as well because everybody depends on the essential workers, and immigrants are essential workers. We need to take care of that. Everybody work close together, yes. And this one of the women that I was having this conversation with, she said, Erika, this is scary. I am afraid to go back to my home and get my kids contaminated and pass them this sickness that is horrible. She said, my cousin has it. My sister has it. My neighbors have it. And I'm just waiting for when I'm going to get it. But I cannot stop working because I don't qualify for any kind of relief. I still have to pay my rent. I still have to pay my bills. And I still have to bring food to the table. And I don't have any time to go and get any other support because I have to work. So that precarious and that is that disparity that we can see is enormous. We can see the difference from essential workers, from non-essential workers in our state, and more of the low-income and poor population are the ones that are, as we can see through the country as well, the most hit and the less fortunate to get resources for them. So we desperately need to pay attention to our community immigrants in the state because it's not stopping. It's not having the resources that it needs. And it's easy for them to keep going deep down. We need a funding. We need a relief funding for families. We want to work with the governor on this because that is an emergency. He said already that he himself said there is no safety. He said the safety is more important than our economy. We cannot have a healthy economy until we have healthy communities. And we want him to pay attention to the South. We want him to listen to the immigrant community. We are sustaining the state, and we deserve that attention. We deserve that care and that collaboration from our government. Undocumented or not undocumented, we contribute to the society, to the economy in a big way in Delaware. And this time is the time of the truth. Since the beginning that this started, is that we are all in this together. We need to see that. We need to see that reflected in actions, in testing, in relief funding for families so they don't have to worry that if they get sick, they're still going to have something to support them. Tony General, Kathy Jennings, she has also been amazing and providing with Spanish resources and making the community aware of not being abused by renters or by stores that can get high prices on things and basic services. And it's important that we keep doing that, but we need to do more. We need to solve the disparity and access to health care. So we have the funding the relief funding that needs to be in place.
Well, let me ask you, matter of fact, about is there a sense in the community that that they don't necessarily want to go to the hospital or to, say, for instance, a doctor because they're undocumented and any interaction with officials, government or non-government officials, might jeopardize staying in the country?
Well, yes, there is the fear. There is a mixture of all those feelings. There is the fear that there might be a repercussion if they qualify for any kind of a status later. It can be a repercussion from them asking for help. The other is that they don't have money because they don't earn enough to pay for private doctors, and also they don't know the language, and it's difficult before to get the test. You have to call the doctor, and if we don't spread that information well, it's also a deterrent, and they are afraid. So yes, the status is an impediment to get health care, but also most important is the money that has to be paid when they go to see the doctor.
I mean, because I know that there are rules, the immigration rules, which indicate that if you're an immigrant and you're applying, particularly for citizenship or visas, that you can't be caught, as it were, getting public assistance, which seems to fly in the face of this crisis.
Yes, and that's pretty confusing. Like people is really confused right now because it's fear from everywhere. It's fear from the federal government. It's fear from especially in the South. The community is not very friendly. There is a lot of racism, and there is a lot of financial, economic disparity. They are not safe. They don't feel safe, and they prefer to hold on and use like home remedies as much as they can. Before going, but the most important thing is the business owners, that they have the possibility to provide every kind of information, make them accountable, and check on their employees and make sure that if they look sick, they're watching over there, they get them tested. They do whatever it takes because the production depends on them. So we have to work together, and it's not an easy problem to solve. So we are waiting to hear from our government to reach out to us and get to work. We're going to send a letter to him today, and we're going to make it public too because we want him to listen to us, and we want to sit at the table. He said, attorney, what is? I'm sorry, it's Lieutenant Governor office. He set up a phone call with us, with the governor, but we don't want a phone call. We want a meeting. We want to address this serious list of issues that we need to solve together, and we want him to give us the attention that we deserve.
What does your letter say?
Well, the letter is pretty much explaining what is happening, what are the disparities, what are the needs, and how can we solve them. It's not that difficult. We just need to pay attention. He needs to design to put people in place to take care of those efforts. One of them is the relief funding. That is not difficult to do. It can be done to make sure that the workplaces are providing the right structure for workers to understand, to be observed, and to be provided with information to go see the doctor, and also to test everybody so the spread can stop. Other than that, we're going to keep going and going. And the last one is to set a team to oversee the funding. How is it going to be distributed? Who's going to make them accountable to make sure that is proportionate to the needs of the community? It's not that much different from the regular community, but since the undocumented community doesn't qualify for any government relief, we have to figure out how to do it, and we kind of picture that, and we just want him to listen to us and do it with us because we are part of this state and we want to make things happen. We also have some issues to address with education and our kids, Latino kids that are not receiving, and in every language, not just Latino kids, but some of them are not receiving the proper support to do good at school, to not lose much of their education, to not being left behind in this space of time. And we want to collaborate with the governor. We want to sit down and get this to function for everybody. We want to help him. We want to help our state, our officials. But for that, they have to open the door for us to see that people and let them help them.
Right, because in fact, one of the things I read was that particularly Hispanics who are low income, that they rely upon schools to feed the children. What's the situation with that, and are the food banks stepping in at all?
Well, it's working in some cases, not in others, because parents have to work, and kids kind of go and pick up the lunches at school. So the food bank has been doing a great effort with providing pantry boxes of fruits and goodies for the families that works. The lunches is not very functional for the immigrant community because parents are working, and there is nobody that can go and pick up the food for the kids, the lunches. So it's a really touchy point. But Latino community, like immigrant communities in general, are survivors. So we know how to make our life work and function, and we do the best of everything with what we can. But for that, we also need understanding and food, especially when there is not additional income, or most of the immigrant community has 2 or 3 jobs as well because the salaries are low, and now they are reduced to 1 job or extra hours in the job, and the kids are alone at home and they cannot stop working. So having food, I think, it's something that can be, it's being all right. It can be better. We can work for it to function in a better way, to ask from participation and more volunteers from the Latino community to help as well because of the language barrier and set the points of taking up food. I was calling different numbers of the food bank, for example, and I got everybody speaking to me in English. So people that don't speak English get confused. And if they don't have somebody to translate for them, they get lost in the call because they give you numbers to access different places. And when you come to these places, if it is a church, you have to to hear the message from the preacher, or if it is another organization, you have to hear the introduction of what they do. And most of the time, you have to leave a message. So if people don't speak English, it's a little difficult for them to literally have access to the resource. They pretty much hang up the phone and say, this is difficult, this is hard, I don't know what to do.
Yeah, well, let me ask you this in those terms. You have a number of Hispanic businesses, and particularly there are lots of businesses that are actually owned by undocumented immigrants. I met a number of them a few years ago. What kind of impact have you seen on those businesses? I know a lot of them are construction, but others have to do with landscaping. But even beyond that, what kind of impact have you seen when it comes to that?
Because obviously everybody's getting impacted. Mostly the restaurant industry, which was blooming with the Latinos and other immigrants, new businesses. What I've been hearing from the community is hurting, like people that have loans or are not essential to the economy. They are hurting. They are posting messages and calling each other, do you have a job for me? Do you have any job for me? And most of them, they don't have qualifications for anything else. And it's hard for them to get any job exactly because of the documentation, the lack of Social Security. So we are, this pandemic is reflecting all those gaps that we have been carrying on that create not just disparities but injustice, because undocumented people pay taxes and there is no path to any kind of legalization, path to residence or citizenship because of the different cases, and we need to be more sensitive about it. We need to pay attention to what needs to be done to recover from this crisis. We need to work together and make sure that every family, including undocumented people, has a path to better their circumstances because everybody's being impacted. The people are scared, but they are willing to look for help as far as they know that there is help, and we have to work on that.
Now, I know there's been a lot of efforts to get some kind of citizenship, visas. Some people are trying to go in that process, but as I understand it, they could face a backlog from the immigration authorities. What do you hear about that? I mean, I understand that face-to-face appointments, for example, and even trials have been suspended.
Yes, there is another concern. Everybody's scared because nobody knows what's going to happen. For now, everything is suspended, but then with the backlog, as you mentioned it, there are all these confusions and times and latings of the papers and dates, and it's confusing. People are really confusing. We're going to need support. We're going to need state collaboration and is do what we can at best, but also like get our officials to also advocate for the community for regulation to take place at a time and at a space where things are accessible and people can really understand what they need to do, and those dates can be really tracked, and they have the time to catch up on all of that, because it's not just checking on the dates, but it's also the language barrier to understand them, for them to access to translators and all of that. And we're willing to find ways to collaborate on this.
Are you? Is there a fear that because of the backlog and because of the difficulty that some folks who were, say, for instance, on the track to get a visa or even move ahead towards citizenship, that they could actually wound up being disqualified?
Well, there is a fear of that because of the misinformation, like following the process and everything that is being said by the courts and the Attorney General and the same ICE office. That is not going to happen. But since the community doesn't have that information right there with them, there is fear. And we also have some people within the community that misinform people as well. So we need to have those channels from government really explicit, targeting information to the community so they know exactly what to expect, what not to fear, and how to collaborate together for this pandemic to get over it.
Now, in terms of the Hispanic media, the Spanish language media, how effective have they been in terms of trying to inform the community?
Well, there is part of the media has been wonderful. One of our local newspapers in Delaware has been wonderful. Since everything started, they've been producing information. They have been interviewing officials. As I mentioned before, Newcastle County Mayor has been amazing. He's go the extra mile trying to speak Spanish as it's best to communicate to people about the urgency and telling the community that he cares, that everybody's protected and safe, that families matter, and that they have to look at the information. And every time that a new regulation comes out, he comes and does another video or reach out to the media to let people know in Spanish, because that is important. I would love that initiative from everybody, not just from the mayor of Newcastle County. And we also have some other outlets like the radio station. There is one radio station that's been also wonderful informing. Another one that is actually creating fear among the people and blaming the community. That is something that we need to work at the state level too, because the community is in fear and is being terrorized by this individual. And it's a systemic problem that is bringing everything that is not working properly in the state, and we have to address. But we are working on it. The community is ready to collaborate. Before you come, I was talking to some members of the community. I said, Erika, we need to do whatever needs to be done. Please let us know. We want to support any effort to help our community. We are tired of being told that we don't understand, that we can't do, that we don't. So let us know what needs to happen for us to collaborate. And that's beautiful. I think that this pandemic is empowering everybody at different times, but I'm happy that the immigrant community is responding well.
Can you, by the way, you mentioned a moment ago that some people are spreading the fear that the community is spreading the virus. Anybody in particular? Are there particular groups that are doing that?
There is, and I can say this because I actually witnessed one of the videos of this. There is a radio station in the South, Maxima. I don't remember the numbers, but the person that leads that radio station has been pretty rough with the community, minimizing them, calling them rapists, drug dealers, criminals for no reason. There are things that have been happening, but the way that he addresses the community and scares them, when a new regulation comes, diminishing people is not the way. We want to educate our community with compassion, with care, with kindness, with information, but not to diminish them every time and tell them that they don't understand, that they are not worthy, and that they have no right for anything, because they shouldn't anyway be asking for support of any kind. and that is really sad. So we are trying to address that as well. The community is ready to address it. He's being bombarded right now in all his media and Facebook because he uses some pretty not nice comments to members of the community, and the community is tired.
Now, I understand that, I understand, by the way, that there are people who have stepped up. I think the United Way, provided something like a little over $42,000 to the Latin American Community Center. Are you seeing support from the nonprofits in terms of helping out your community?
Yes, there are good efforts. United Way reached out to me last week to ask about exactly the grassroots communities. I'm very grateful that they're doing that because they need to be in contact with the community. I suggested them implementing a hotline with people that can, where people can record messages about what they need, and if they don't find it in their language, so people from different languages can translate that and resolve what those families need. Also, I recommended different things, explicitly to print information in every language that they can, so those communities have access and we can distribute those papers with information to everyone. The Bank of Delaware is also going the extra mile. They are collaborating with organizations, and we are getting there as a state in the food distribution. We can do better. We must do better, and if we collaborate more, we will. But yes, I'm very pleased that organizations are paying attention to the needs of the immigrant community as well.
Are you ready for this long haul? I mean, it sounds like this thing is going to go on for perhaps months.
Yes, well, I made my peace. As a community advocate, I am a mother of two kids, so it's complicated, but I know what is my role in this pandemic, and I don't give up on anything. I know that we can do much for our community and every community, because I am involved with the wider community as well. We created a page that is called The Helpers, so everybody can have access to resources, and anybody that knows from resources posts on that page. And it's been beautiful, the response of the community. So I'm ready. I'm ready to get over with this, to fight for this pandemic, to go away from our state, to leave alone our people and every single person in our community, and reconstruct our state and recover our economy. I'm ready for that.
By the way, just briefly, how are your kids reacting to all of this?
Well, it's interesting because in my case, my children, well, I am a community advocate, and I know how to make them feel safe and strong and empowered. So my daughter, she's doing fine with her program at school. Not every kid is lucky like she is. She had a really good school that is providing. Since day one, they provided her with everything she needed. She had a computer. She had access to the internet. They started sending homework since the first week, and then a full program in the second week. For my son, he actually is doing amazingly better with distance education. It's incredible. He likes to get his things done, and he understands his videos. He's happy. He's discovering that he really likes homeschooling. It's so interesting.
Well, that's good. That's good to hear. We've been speaking with Erika Gutierrez. She is a community advocate for a number of groups within the state of Delaware, and we do certainly appreciate you taking the time to talk with us this morning.
Thank you. It was a pleasure. Looking forward to keep listening great stories from you. Thank you for bringing the voice of the community to the wide audience.
Certainly. This has been Delmarva Today. I'm Don Rush. Thanks for listening.
Thank you for watching Delmarva Today, a production of Delmarva Public Radio. Production and audio engineering by Chris Rank. Hosted by Don Rush. For podcasts, visit delmarvapublicradio.net or subscribe to the Delmarva Today podcast on iTunes. You can also watch Delmarva Today on PAC 14 by tuning into Comcast Channel 14 or youtube.com/PAC 14.